Hey guys, hope you're doing well. So today I wanted to make a video all about teeth. As some of you guys might know, I am a dental hygienist and I get a lot of questions from people in the fruit community, in the raw vegan community about their teeth, how to take care of them, what I recommend, in terms of self-care and what to do, if they have a cavity, should they get it filled, all that kind of stuff. So I'm going to go over what is a cavity, how to prevent it. I'm going to talk about gum disease, how to prevent it, and what to do if you already have it. And then I'm going to show you the products that I personally use and what I recommend. And then I'll actually show you how to use it. So I'm going to show you how to brush and floss your teeth properly at the end of the video. So stick around for that, because a lot of people think they're doing it properly, but they're really not. So I'm actually going to show you how to do it on my own teeth, okay? So let's get started. And the first topic that I'm going to talk about is cavities. So what causes cavities? So a cavity is basically a lesion, a hole, a decay in the enamel. The enamel is the outermost surface, the outermost layer of the tooth. So we have the enamel, the dentin, and in the middle you have the nerve or the pulp layer. So the cavity always starts from the enamel and then moves its way to the inner layers. So a cavity is a lesion in the enamel, which just means that the structure of the enamel has been broken down. And so what causes this? This is caused by acids in the mouth. And basically there's two sources of acids. Excuse me. One source is the bacteria in your mouth. So we all have bacteria in our mouth, and certain types of bacteria secrete acid. So when you eat some kind of carbohydrate-y type, sugary type food, be it fruit or whatever else, that is food for the bacteria. I'm not saying don't eat carbs, just hear me out, obviously. So that is food for the bacteria, and the bacteria actually excrete, or piss or whatever, acid. That is their waste product, and that acid is what is causing the breakdown of your enamel. So that's one reason why you might get a cavity. Another reason is from just the acid that is in the food. So like especially citrus, unripe citrus. And most of us, we're not eating tree-ripe fruit, unfortunately. So it's kind of hard to avoid acidic citrus if you're eating citrus. So so the citrus in the fruit juice can actually erode your enamel as well. So you might be wondering, well, why is it that some people get cavities and don't really take care of their teeth? They just seem to be lucky, and some people take like meticulous care of their teeth, yet they still get cavities. And the answer is it's kind of due to three factors, whether you're cavity prone or not. And one of the factors is just genetics. So some people have a stronger tooth enamel. The structure of it is just built better. And a lot of people also have a nice alkaline saliva. And so if you're eating a lot of processed food, which I'm sure, if you're a raw vegan, you're watching this, you're not eating processed food, but for anybody else watching this, if you're eating processed food, it will cause your overall body chemistry to be more acidic, and therefore your saliva will be more acidic, and therefore you'll be more prone to cavities. So your tooth structure and your saliva, those are big factors in whether you're going to get a cavity or not. Another factor is diet. So if you're a fruitarian and you're eating a lot of dates, a lot of dried food, a lot of orange juice, if you're sipping your smoothies or your juice over a couple hours, you're gonna totally be more prone to getting cavities than if you just were eating or not mono meals, but different fruits that weren't sticky, like say if you're eating mangoes and papaya, or apples, like that kind of fruit doesn't stick to your teeth. It's the sticky stuff like the dates and the dried fruit that is the worst. And I'll tell you more about what to do if you still want to eat those foods. So diet, genetics, and then of course it depends on how you're taking care of your teeth as well. So even though your diet is so good, it doesn't make you invincible. And I see a lot of raw vegans, fruitarians thinking that, well, my diet is perfect, so nothing's ever going to go wrong with my body. And it's just not the truth. You still need to take care of your teeth. Just because you have a perfect diet does not mean you don't have to take care of your teeth and brush and floss. So definitely, you need to brush at least twice a day and floss at least once a day, and I'll go over that at the end of the video as well. Okay, so I'll go over some do's and don'ts. So especially if you're one of these people who has weak enamel, and you'll know if you're one of those people because you'll have a lot of fillings and whatnot. So things to avoid: if you can, avoid eating dates just like that. If you want to blend them and put them in sauces and smoothies, that's a better option. But just eating dates like that is not really a good thing to do for your teeth. Same with dried fruits. The reason is because when you eat that, it's just so sticky and it sticks to your teeth like glue, and it just becomes food for the bacteria to be they just have a party. We love carbs, and so do they. So they just go crazy eating and secreting acid. So as long as you have a piece of dried sticky carbohydrates stuck to your tooth, there's going to be bacteria feeding on that and secreting acid onto your tooth. So all right, so if you do want to eat dates or dried fruit, what I really suggest you do is floss your teeth. Don't snack on it for an extended period of time. Just eat it, be done with it, and then floss your teeth. Get all that stuff out of your teeth. Rinse your mouth out so that you're diluting the acid in your mouth that the bacteria are producing. And once you've rinsed it out really well, then brush your teeth so that you're just getting it all out. Because an important thing to remember is every time you expose your teeth to, or anytime you eat something sticky, some carbohydrate type food, for 20 minutes after, you are going to have a quote acid attack happening on your enamel. I know it sounds really scary, right? Acid attack. But yeah, so if you're sitting there and eating a date, and then half an hour later, you're eating a few more dates, and you're doing this over a few hours, you're getting your teeth are being bathed in acid constantly. So it's much better to just, eat, be done, then clean your teeth. The same thing goes for juice and smoothies. I see a lot of people, they got their big, liter or 2 liters of smoothie or juice, and then they just sit there sipping their smoothie for the next hour or two. So try to drink your smoothie relatively quickly. Don't chug it down, but try to drink it within, 20 minutes, because the shorter amount of time that your teeth are being exposed to carbohydrates, the shorter amount of time that your teeth are going to be exposed to acid. And you don't necessarily need to brush your teeth after every time you eat something, but at least, floss the chunks out. If you're eating dates or dried fruit, well, first of all, try to avoid it. But if you're eating it, for sure, floss out the pieces. Make sure there's nothing stuck to your tooth. Rinse your mouth out, and if you can, brush, but you don't always need to brush. But just make sure the chunks are out and you're rinsing with water to dilute the acid. I'm going to talk about toothpaste at the end of the video, but I'll just mention here that I don't really support or promote fluoride. So as for the toothpaste, I would use a natural one with some xylitol. And also there's, don't chew gum, obviously, like aspartame gum, but you can get xylitol. It's a natural product. It's made out of the bark of a birch tree, And it's a natural sweetener and it's an anti-cavity. I'm sure you've probably heard of xylitol. So you can actually get gum or mints from a health food store that have xylitol in them, and they are very effective. So if you're one of these people who's super cavity prone, after eating some dates or dried fruit or having a smoothie or something, or bananas, something like that, chew a piece of xylitol gum, because it'll do your mouth some good. Another thing you can do is oil pulling. I'm not going to make a whole video about this because there's tons on YouTube, but basically oil pulling, you do it once a day for about 20 minutes, and it kind of like pulls all the bacteria and toxins out of your oral environment. And there are studies published in dental journals that do show that oil pulling is effective. So that's something that you could also look into. Also, I watched a really great video that Megan Elizabeth put out a while ago about teeth, and one of the things she mentioned in the video was that if you have a vitamin D deficiency, you're more likely to get cavities. So definitely look into your vitamin D levels. Okay, so what to do if you have a cavity? So I know a lot of you probably would feel resistant to putting some kind of foreign material in your mouth, and I totally understand that. If you look online, there are a lot of people who discuss and blog about natural tooth decay remedies. And to be honest, I haven't really looked that much into it, and there aren't any studies testing these remedies. And that doesn't mean that they don't work. It just means that, the pharmaceutical companies aren't, willing to fund that kind of research. So of course, why would there be that kind of research? So that's not saying that these kinds of things like clove oil, and there's other things that I haven't looked into it, but if you have a cavity and you're just super resistant to getting it filled, look into that, do your own research. I can't really tell you which one works, which one doesn't, because all of the stuff online is kind of like anecdotal, and I personally haven't tried it, so I can't tell you this works, don't do this, this works, or don't do that. So what I would say is do your own research, try it if you feel confident in trying it, and let me know if you have any stories of what works for you. The only kind of risk in doing something like that is if it doesn't work, then the cavity could just end up progressing and getting bigger and causing a bigger problem in your tooth. Like, say if you have a cavity and you're like, oh, okay, no, I'm not going to get it filled, I'm going to try to do a natural remedy. And then 6 months down the road, you go back to the dentist and they check and it's actually gotten bigger and it's actually gotten closer to the root. Now that's something you really want to avoid, because once it gets to the root, then you might need to get a root canal, and you don't want to get a root canal because root canals are risky business. Your tooth has like so many more canals than the dentist can actually fill. So if the bacteria are in the nerve now and you get a root canal, it's not always 100% chance that all the bacteria is going to be eliminated, and you can get problems down the road. So if you can, whatever you can do to avoid a root canal, that's what I would do. So personally, I've never had a cavity in my life until a few months ago. I actually got one cavity on my lower right on the root surface where I have a bit of gum recession. And the root surface is actually softer than the enamel, so that's why the cavity kind of formed there. And I opted to get it filled just because it was on the root surface, and I know cavities can move quickly when they're on the root surface towards the innermost layer of the tooth. And so I just wanted to nip that in the bud and avoid that. So you might be wondering, well, why did I get a cavity? And honestly, I'm not really too sure why I have an idea. Okay, so I never had a cavity before. I have really strong enamel and good saliva, so I never had a cavity. When I was a kid, I actually didn't floss. I didn't start flossing until I was like 20, and I only brushed my teeth once a day, so I'm one of those like annoying lucky people with good teeth. But I also have this habit of grinding my teeth at night or I mean, in the past, I think I did it more clenching my teeth, grinding my teeth, and I had a night guard, but I stopped wearing it. And what grinding your teeth does is it can cause gum recession and expose the root. And it can also make little chips in your enamel right at the base of the tooth so that the root is exposed. And like I said, the root is much more prone to decay than the enamel. And also, over the last few months, I kind of got into a funk in the summertime. Some stuff happened to me. If you watch my videos, then you might know what I'm talking about. And I kind of got a little bit depressed and just not caring as much about myself, and I kind of stopped brushing my teeth in the morning. I know, it's gross, but so I would like have my breakfast, which would be like a smoothie or banana cereal or mangoes, and then I just wouldn't brush my teeth. I would just go to work like that. You know, and I also got cocky because I was like, I've never had a cavity. I don't care. I'm just going to brush my teeth once. And I just didn't really care. I wasn't thinking. And I was also eating more dates, more dried fruit. And lo and behold, I started getting a soft spot on my root surface. And I had to get it filled. So out of the two types of fillings that you could get, you know, like the white, the composite, the plastic ones, or the metal, obviously, I would recommend the plastic ones. I mean, there's still lots of stuff online showing how those ones are poisonous and blah, 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 but I think it's still a better option than having the mercury fillings in your mouth, for sure. So now I'll talk a bit about gum disease. Gum disease is the degeneration of the tissues that are supporting the teeth. That would obviously be the gums, and it would also be the bone that is surrounding the tooth. There's a few different things that can cause gum disease. One of those things is having braces done and having it done too quickly, too aggressively. When you have braces done and it's done too quickly, then it can actually cause the bone to dissolve around your teeth. It can cause the roots of your teeth to shorten, and it can cause gum recession. So you got to be careful when you're having braces done. Just make sure you have a good orthodontist and he's not rushing. He or she isn't rushing. So also, gum recession can be caused by grinding your teeth, and grinding your teeth can also cause abfraction. And abfraction is just basically the chipping of enamel near the base of your tooth. I'll just show you. So like right around here, that's the where the enamel and the root meet. If you're putting a lot of pressure on your teeth, you're clenching your teeth, grinding them, that's going to cause the enamel to kind of chip off and expose the root, and also cause gum recession. If you're not sure if you're grinding your teeth, take a look in the mirror. Like if you have gum recession, you're like, why is this happening? Take a look in the mirror and see if your teeth look kind of like worn down and flat. If they look flat, then it's a good sign that you're grinding your teeth or clenching them at night. If they've got lots, those nice peaks and valleys, then it's probably not due to grinding. Also, if you wake up in the morning and your jaw's kind of sore, then that could be, from grinding your teeth. So there's nothing you can actually do to stop other than kind of reprogram yourself to be less stressed out and to be less neurotic. And that will help you stop grinding your teeth. But you can also get a night guard that will, you wear that at night, and that will protect your teeth. Even though you are biting down and grinding, you're just grinding into the night guard and not damaging your teeth. So that's one thing you can do. Another thing that causes gum disease, especially the gum recession, is aggressive brushing. So a lot of people kind of like brush their teeth like really hard, like back and forth, and they're using like a medium or a hard toothbrush because they think that'll get their teeth cleaner, and that's really, really bad. You want to be using a soft toothbrush, and you want to be brushing your teeth gently. And again, I'm going to go over how to do that at the end of this video. But yeah, so I see a lot of gum recession due to people like really scrubbing their teeth, really trying hard to make sure their teeth are extra clean, but it's actually hurting their gums in the long run. Eating a lot of acidic food can actually cause gum recession as well, so that's another thing to be aware of. The main cause of gum disease, though, is poor oral hygiene and lack of regular cleanings. So we all, have bacteria, lots of different types of bacteria in our mouth, and most of the bacteria are, quote, good bacteria. But there are some bacteria that the body doesn't like and that can overgrow if we don't take care of our teeth properly. And we all have this space called a pocket around the tooth, and it's natural and normal. And the pocket, though, should only be about 1 to 3 millimeters deep. I'll kind of show you that space on my tooth. So hang on. So if you can see here, and sticking it in there, see? That's just a normal space around the tooth. However, if you get an overgrowth of bacteria, they start getting into that pocket and multiplying in that pocket and basically causing an infection. And that causes inflammation in that area. And the body's inflammatory response is to kind of degenerate those tissues. So if you get a lot of bacteria in a pocket, that pocket is going to start getting deeper. It's going to go from 3 millimeters deep to say 4 or 5 or 6. And once you start getting like 6 or 7 millimeter pockets, like that's no good at all. That's some serious business. I don't want 7 millimeter pockets in my mouth, because 7 millimeters deep, it's like you can't floss down there, and a hygienist even has a hard time getting into like a 7 millimeter pocket. It's just really hard to clean in there. So you just really want to prevent those bacteria from overgrowing, and the best way to do that is just by regular flossing and regular dental hygiene treatments. Okay, so if you have gum disease, what should you do? Well, you should definitely go for regular cleanings, because like I said, the pockets are hard to clean by yourself. If they're deeper than 4 millimeters, it's going to be really hard to get in there with a floss. So you definitely need to go to your dentist regularly and make sure your hygienist or your dentist is really giving you a thorough cleaning that is really cleaning under the gums. In Canada, every time you go to the dentist, they do clean deep under the gums, but I don't know if they do that in the States. I think that you have to get either like a regular cleaning or you get like a deep cleaning. I think it's a little bit different in the States. So you really want to make sure that the hygienist is cleaning the tartar and the bacteria out from under your gums. And also, of course, you need to be flossing at least once a day. It's so important, I swear. Brushing at least twice a day. There are other tools that you can use, such as like a sulca brush or a water pick, and you should just, talk to your dentist or your hygienist and see, what's actually best for you. Unfortunately, with gum disease, there isn't really something you can do to, regrow your bone or regrow your gums. It doesn't really work that way. Although I have heard of people saying that they did have some of their gums growing back after doing a water fast or a juice fast, but I personally haven't seen any pictures, so I couldn't tell you yes or no. It's something that you could look into though. But if you do have a lot of gum recession and you're kind of self-conscious about it, there is something that they can do called grafting, which is where they take tissue from the palate, from the roof of your mouth, and kind of sew it over the area where it has receded. But in terms of the pockets, if you have a 7 millimeter pocket, it can often, be turned into like a 4 millimeter pocket if it's thoroughly cleaned out and you're like maintaining hygiene and all that and having your regular cleanings. The bone surrounding your tooth, though, if you've had bone loss, that actually can't really be grown back. So, in essence, it's just so important to prevent this from happening. And if it's started, to just stop it where it is and not let it get any worse. Because if you get gum disease that is really, progressed far along, you're just going to have loose teeth. It's just you're gonna have an odor coming from your mouth, and the only option really once it gets that bad is to pull out the tooth, and nobody really wants to be losing teeth, right? Okay, so I'll show you some of the products that I use, and I don't mean like that you need these products in order to have good teeth. This is just what I'm using now, and so I'll just share that with you. So as for toothpaste, I always try to use a natural toothpaste, as natural as possible, with the fewest ingredients as possible. And the toothpaste that I found that has the least amount of ingredients, the no fluoride, most natural, is this stuff called earth paste. I know it's backwards, but yeah, earth paste. This stuff's not bad. I don't really love the taste of it, and I kind of find it a little bit abrasive, so I actually haven't been using this one as much lately. Instead, I've been using this stuff from the health food store as well called Nuco. I don't know if you can see that, but this one has a few more ingredients, but it doesn't have any fluoride. It has stevia, tea tree oil, aerobic oxygen, whatever that is, and no sodium lauryl sulfate. It's nice and minty. It's not abrasive, and I like this one a lot. The brand is Nuco. If you're in Canada, you can probably find it at your local health food store. And sometimes my teeth get sensitive, so I will use Sensodyne when my teeth get sensitive, but I only use it when my teeth are sensitive, and then I stop using it, and I really try to make sure that I'm really not swallowing any of the toothpaste because it does have fluoride in it. Okay, and I also, this is like my favorite tool ever. This is a tongue scraper. So this is my favorite tongue scraper because it has two sides. So one side has this brush on it. So first you kind of like scrape your tongue, brush your tongue with the brush side, and then you turn it over and use this hard side and kind of just like, I'm not going to show you because it's gross. That's the only gross thing that I'm not going to show you how to scrape your tongue. You know, I'll show you on here. Brush, 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 brush your tongue, and then you flip it over and go just like that. And lots of stuff will come off your tongue, especially if it's like the first time you're doing it. You'll be like, whoa! And it really makes your breath a lot fresher and just makes your mouth feel so much cleaner. So usually what I do is I floss, then I brush, and then I scrape my tongue. Okay. For toothbrushes, I prefer an electric toothbrush, and my favorite brand is the Philips Sonicare. I've used the Oral-B ones as well, and they work great. I just prefer the vibration of the Philips Sonicare. It's just my favorite. They're both good, but this is what I like using, and I'm actually going to even take this with me when I'm traveling, because when I went to India and I didn't bring it, I was like, oh, my teeth feel gross and dirty, and I don't like using a manual. But, you know, if you're using a manual one, that's fine. But if you can get an electric one, it's better. All of my patients who use electric toothbrush have far better oral hygiene. Not far better, but okay, I'd say most of the people who use an electric toothbrush have much better oral hygiene, way less plaque and bleeding and all that than people who brush their teeth with a manual toothbrush, just because this thing just does a better job. It just does. It's just easier to do a good job with an electric toothbrush. So I personally love electric toothbrushes, so I recommend them. But if you don't want to use an electric toothbrush, then use a manual one, but use a soft one. You can get natural ones. This is just a conventional one. You get more natural looking ones with bamboo or, you know, whatever. But just make sure it's soft. If it's medium or hard, it's going to cause gum recession and abrasion on your teeth, and you don't want that. So let me show you how to brush your teeth if you're using a manual brush. So a lot of people, like I mentioned earlier, they'll just like scrub back and forth like really hard like that, and that's really bad. So don't do that. What we learn in school, what we're supposed to show people is to do this thing where you kind of like go like this and then sweep down. So you're putting the toothbrush at a 45-degree angle at the gum, and then rotating and sweeping down. And that's like the perfect way to brush your teeth. And you're supposed to go do a few strokes in the back, then move it along, move it along, move it along. But I personally don't have the patience to do that when I use a manual brush, and that's just the truth. So what I do is I just do nice gentle circles. So I just go like this. Just don't do this. If you're going to do circles, just be nice and gentle. And you want to do the inside of your mouth, obviously, too. A lot of people forget down there and the insides of their mouth. So make sure you brush the insides just as much as you brush the outside, because so many people have like so much plaque and gunk on the inside of their teeth, like right in here. And they're like more focused on brushing the outside of their teeth. So the outsides of their teeth are really clean, but the insides are like really bad. So brush the insides of your teeth as well. And how long you should brush your teeth for? Well, most people only brush their teeth for about, 30 seconds, but we should really be brushing our teeth, if you're using a manual brush, at least 3 to 4 minutes. And you might feel like, oh yeah, I'm doing that, but just time yourself and see how long you're actually taking, because I bet you're not brushing your teeth for 3 to 4 minutes. Well, you're probably not. I don't know. Maybe you are, but probably you're not. So you just need to brush longer. If you're using an electric toothbrush, then you can brush for 2 minutes. That's fine. I personally brush 2 minutes on the top and then 2 minutes on the bottom, because I'm a little bit like obsessive about my teeth and I just really like them to feel totally super clean. So I usually brush my teeth for 4 minutes. Sometimes in the morning. Now, since I'm brushing my teeth in the morning again, I'll just brush for 2 minutes, but then always at night, I always brush for 4 minutes. And so with the electric toothbrush, you just want to make sure that you're not pressing hard. And what you want to do is just put it up, turn it on, and just hold it in one spot, and then just slowly move it around your mouth. You don't need to like do this. Don't do that. And don't do this. Just hold it there and move it along. Okay, so it's pretty basic. It's hard to screw up brushing your teeth with an electric toothbrush. That's why it's so great. All right, floss. So you can use any kind of floss that you want. Just get the floss that works best for your teeth. So a lot of people have like really tight teeth, so maybe like more like a waxed floss or more of a flat one would work better. I don't really have that tight of teeth, so I use this stuff called expanding, and it actually, like, once it touches your saliva, it kind of expands and it kind of like becomes this kind of like sponge when it like picks up more of the plaque. Okay, so I'm going to show you how to floss your teeth. So what you want to do, I'll just explain first. You want to wrap it around your middle fingers, and then you want to use your index fingers as a control. And you're going to go in between. And now you're going to wrap the floss around the tooth. Right now I'm doing the canine, okay? So wrap it around in like a C shape. And now you're going to move it up and down under the gum 3 times. Okay, now you're going to wrap it around the tooth next to it and up and down. Okay, so every time you go in between 2 teeth, you're doing one tooth and then you're doing the other tooth. And you really want to go under the gum. Like, that's what you're trying to clean, under the gum. So don't be afraid to go under the gum. Don't get in there and be like wham and like shove the floss down like super hard, and that's not going to be good for your gums. But you want to do it gently, but you do want to do it thoroughly. So I'm just going to show you a couple more teeth so you can really see what I'm doing and, practice it and make sure you're doing the same thing, okay? See how far under the gum I'm going? Yeah. Show you on the top. See, I'm totally going under the gum there. So you want to make sure you go up and down, not just once, but like 2 or 3 times. Okay? So I hope you found this video useful, and I hope you enjoyed the close-up of my teeth. If you have more questions about teeth, just leave them in the comments below, and maybe I'll do like a follow-up video. I'll do a video just answering all the questions that you're going to leave in the comments, so that'll just be easier for me than just responding to every comment. Yeah, I hope you enjoyed this video, and don't forget to brush and floss. And if you haven't been to the dentist in years, don't be afraid. Go get it checked out. Really, it's better to have things addressed earlier on than to neglect it for a long time. Teeth are so valuable. I love my teeth, and we just want to do whatever we can to prevent losing our teeth, right? Because they're so important. Okay, guys, thanks for watching, and I'll see you next time. Bye. Check out my night guard. Sexy, right?